Hi there. So today I'm going to be talking about the MCL, which stands for the medial collateral ligament, which is found on the internal side of the knee. So today we're going to be talking about the different kinds of grades of tear. We're also going to be talking about what kinds of exercises can help you to recover quicker, and then we're going to talk about keeping that movement on the MCL so that you're continually having repair on that ligament. So first things first, you tear your MCL, or you feel like you tear your MCL. There's three things that happen that you can test to see if you have. So first thing is if it's sensitive to the touch. So if you have a trainer or a coach that's telling you whether or not they think your MCL is torn, they're gonna feel it. They're gonna, if that's sensitive to the touch, then we're gonna know that you have an MCL injury of some sorts. That's gonna be on the internal side of the thigh, like I was saying earlier, towards the knee. And so then the second is going to be a limited range of motion, and the two limited ranges of motion are going to be both in flexion and extension of the knee. You're not going to be able to do the full extension or the full flexion, and so we're going to see a lot of pain when that happens, when you're trying to do that, or we're going to see a lot of hurt. So then these three images show the different ranges of the tear, so how it can look. So it could be a strain, it could be a partial tear, or it could be a full tear.
Next, I'm going to take you through some exercises that are going to help you at the beginning. So right when you injure the MCL, these are going to be some of the strengthening exercises that can help you to start that process of recovery.
This my excavation to days cool. Everything that happens is from now. This is boring. This is paralyzed. I keep throwing it down to
Once you've completed those exercises, I'm going to have you move on to these next exercises that are going to help strengthen it even more. But you better be in a spot where you're not feeling any pain on the MCL or in the knee area, because we don't want to make that process of recovery take longer than it needs to take.
And you're drunk as hell. On your back with the Rex as the stacks you low. On your back with the Rex and the stacks you low. On your back with the Rex and the stacking you low. I've been twisting to the sun. stack.
All right, so after you're done doing those movement exercises, we're gonna move on to testing to see the recovery process. So we're gonna go into the goniometer, where we're going to both test range of motion for both flexion and extension, and we're going to be able to see like how far you're along in the process. So the points that you would meet the goniometer at are going to be the lateral epicondyle, of the femur, the greater trochanter, and then the lateral malleolus. Those are going to be the three spots where the goniometer is going to lie on the leg. It'll be down the external side of the leg. With the test for the extension, we are going to have our regular or constant at 0. So the ultimate goal is to get to that 0. If they're not able to move that fully to 0, then we're seeing that we still need to keep stretching. We need to keep doing these exercises. As you can see in that image, for flexion, we are going to do the same process, same points of contact with the goniometer, but it's going to be anything below or above 90 degrees. Is that what we're gonna try to hit at? Ultimately, the goal is to get to 120 degrees. That's going to be kind of a regular there. There you have it. So that's going to be how you can fully recover and repair your MCL injury from start to finish. Keeping on doing these exercises and continuing the process of healing is also going to be important in the growth of the muscle around this ligament that we have injured. So continuing doing this, continuing stretching, continuing seeing the doctor or your physical therapist in order to make sure you have the help is also very important to do. So before you get back into those exercises and sports that you're used to doing, make sure you're fully healed or it can just fire back up again. So thanks.